So I'm just going to move on to the question. Or I'll have you to please, you have your speech ready.
Hello. Were we supposed to be having a speech or just enter a conversation? I don't understand.
Yes. So.
Okay, we have a 5 minute.
Yes.
Okay.
You have 5 minutes each.
Okay, I see. I see. Okay then.
So starting from Mr. Segun Arize, the current president, right, of the voiceover artists of Nigeria.
It's called Association of Voiceover Artists.
Association of Voiceover Artists
of
Nigeria. Shoot, sir.
Thank you. Okay, distinguished ladies and gentlemen, good afternoon, and it's a great opportunity to be here. I do not take it for granted, and same as my co-panelist here. We're talking about healthcare in Nigeria today, using Nollywood as a catalyst. Nollywood started, like Amana said, in a way that nobody expected it to start. I'm a living witness to it because I was part of that process. Nobody gave us that chance. And then the big deal was, I want my son to be a doctor, I want my son to be a pilot, I want my son or my daughter to be an accountant and all that. And then we started out with sweat, blood, our money is put in and all that. And well, by dint of hard work and the grace of God, Nollywood has become what it is today, not just in Nigeria, but the whole of Africa and the world at large. But one thing that we do not take into cognizance is the fact that in our nature of work, we're very busy people. We're from point A to point B. Everybody's so busy. We don't even have time for ourselves. We even hardly take breaks. Unlike Harvey and other clients in Hollywood, they can shut down and say, okay, I'm going on a holiday. I'm taking my family out, or I go check on my health. This part of the divide, it's not like that. I also think it has to do with the environment, the way our culture, the way we cultured ourselves. When I say culture, I'm not talking in terms of traditions, and I'm talking in terms of the behavioral pattern. We are people who work so hard and think less of our health, and it's in every sphere of Nigerian life. We don't take it seriously. All you think about is the money, the money, the money, the money, and then when you take ill, it becomes a problem. Sometimes you work so hard, you work like an elephant and eat like an ant. And at the end of the day, a lot of my veteran colleagues, people before me, after getting ill, because they did not take care of their health and they did not prepare for it, you find us running around trying to contribute money, donate money, and all that. Not even just that. There's nothing like HMO or healthcare delivery for all the association. We have, as I speak, we have over, correct me if I'm wrong, Ireti, we have close to like 30 associations and guilds in Nollywood today. None has a proficient, none has a healthcare delivery that works, a HMO that works. It's okay, if you take ill today, this way you can go and draw money. A lot of them don't even put the money there. They won't. And so how do we also, as people in the industry, how do we also help engage? By telling our stories. You can use Nollywood to tell stories, but unfortunately, I want to be very, very blunt here. Unfortunately for us, most of us who are in the business are not doing what we practice, what we say. But we have a great platform that can be used to catch the grassroots. Our stories, advocacy, going out to meet people. A lot of people see us as role models. They can tap into it. Oh, I saw this guy playing doctor in the movie. Oh, are you a doctor? I saw this person playing nurse. Are you? Okay, for my own instance now, I can't even remember how many roles I've played as a doctor, except for the parts that they give me, the bad parts that they sometimes people see me play. Okay, I'll just give an example. Like, there was one time I was standing on the road at the height of Black Arrow. One woman walked up to me and was, "Can't you get another role? Can't you play another good role?" I said, "No, madam, it's a job. Somebody has to play. If there's a role for God and devil, somebody has to play devil. He said, no. Your own is too much. And she was walking away. Now, imagine if I was a doctor. Every time I play doctor, I'll be impacting. Just the way Aproko started using this platform to send messages out every time. By the way, I'm a big fan of yours, Aproko. And I like the name Aproko too. So, if we can use those our various platforms, channels, grassroots distribution, go out to the populace, those who need it, and then engage with government and engage with platforms like this, like PSHAN, not PSHAN, like PSHAN. If there can be a partnership, there will be that growth, there will be that development, there will be the news spread, there will be the grassroots support. Check around this country today. You go around in all villages and hamlets. How many medical centers do you have? Even in our movies, we don't have it. But if the partnership's okay, we're going to use this platform to say, for every movie, let's talk about health. There was somebody who was trying to do that some time back, but I don't know what happened. Somewhere along the line, it got lost in translation. You're telling stories about healthcare, how you go to every village to set up where healthcare delivers homes, just small hospitals and clinics. So if we do that, I think we, as Nollywood, can help project that, tell that story out, put it out there for people, and also engage the government. You can't go to the Ministry of Health today and say, hey, I have a project on health and how it will reach the masses. Politics will get into the way. I'm sorry to say. Politics will get in the way. As much as you have that lofty ideas, something will nip it in the bud for you. And before you know, that dream goes kaput. With all the good intentions that you have, somebody somewhere will throw a spanner, and that will be the end of that. It doesn't make any sense. I mean, also big firms like Dangote, like Glow, like MTN, I don't see any reason why they cannot use Nollywood as a platform to say healthcare. Let's tell a story about how we can reach people. Look at our environment today. I'm sorry to say, before I hand over, our environment today is very dirty. Very, very dirty. Now, what if there's an epidemic or a pandemic? What happens? Look at every nook and cranny in Nigeria. Let me not just use Lagos. There are people selling all sorts of manners of things on the way, some cooking on the way. You pour water, stew, oil. The drainages are all filled up. These are part of things that you inhale all those things, don't you? You do. In the traffic, you're going, somebody is, those children begging, all sorts happen. Just close your eye and just imagine your environment. So what happens if a disaster happens? We just came out of COVID a few years back. How are we prepared in case something else like that happens in the future? So I think it's time we take ourselves seriously, and the industry called Nollywood should also engage, and let's see how we can get to the grassroots. Thank you so much.
Thank you very much. Can we please? Thank you. All right. Now, should we take that as him speaking for Nollywood? All right. Okay. Okay. All right. Now, over to you. Let's do that quickly. Thank you.
Good afternoon. Thank you so much for having me. Healthcare in West Africa has many challenges. Limited funding, difficult access, as well as cultural barriers that affect how people seek and receive care. Also, traditional health messaging often struggles to connect deeply with communities, more so with young people. And this is where creative innovation can play a critical role. With the benefit of 3 decades as an actor, producer, writer, I have experienced firsthand how storytelling can move people and shape ideas. The creative sector excels at telling stories that feel real and are relatable. When people see their lives reflected on the screen or hear stories in their own language, health information becomes meaningful, trusted, more personal, and as a result, easier to act upon. This is not just theory, it's already happening across the region. MTV Sugar, The drama series uses relatable characters and storylines to tackle issues like HIV prevention, sexual health, and more recently, COVID-19. Research shows that post-viewing, more young people get tested for HIV and adopt safer behaviors. The show breaks stigma and opens up conversations that traditional health campaigns often cannot. During the Ebola crisis, a short film titled Salah's Story, produced in Liberia, told the story of a survivor who helps to educate her community, reducing the level of fear and misinformation. By seeing someone like themselves on screen, people became more willing to trust health workers and follow safety protocols which improve the outbreak control. The Community Theatre for Malaria Education in Ghana is another example. It had local theatre groups perform plays in rural communities portraying families affected by malaria. These interactive performances engage audiences directly, prompting discussions and encouraging simple but effective preventive actions like using mosquito nets. This approach increases understanding and motivates real behavioral change where health facilities are far away. Another example is Sisters of the Soil, a radio drama produced in Sierra Leone, which tells the story of women farmers dealing with maternal health issues. It reaches listeners in remote areas without internet or TV, providing practical information on prenatal care and safe childbirth. This is a practical example of how creative media can extend healthcare education beyond clinics. These creative projects do more than spread information. They build trust, reduce stigma, and inspire people to seek care early. They also attract investment, showing funders the real impact of community-driven health initiatives through compelling narratives. By integrating storytelling and creative engagement into healthcare strategies, we improve awareness, change behaviors, expand and strengthen a service delivery that is sustainable across West Africa. The creative industry offers practical tools to tackle healthcare challenges, not just through data and policy, but through stories and emotional connections that reach people where they are. In the creative industry, we do not wait for perfect conditions. We create them. And this is the spirit required in West African healthcare. Agile, rooted in local culture, powered by human connection. And as we look to renovate healthcare in West Africa, without a doubt, a collaboration between the healthcare sector and the creative industry can unlock new opportunities for impact. Thank you so much for listening.
But for time, I would have asked you to read that again, not because they didn't understand, not because you were not audible enough, but just because I would like to hear your voice again. Can we please give her a round of applause, please? Now, to you, Dr. Kafi.
Yeah, got it. Good day, everybody. I come from generally what we call more of a unique industry, which is dance industry, which is a sector of the creative industry. And we all know, or most of us, even though sometimes I think is in hindsight, the importance of dance as a wellness tool or a wellness practice. We can keep talking about the degenerative nature of health, human health in Africa, as well as the healthcare services, but I don't think we also emphasize enough of the practices for preventive healthcare. And preventive healthcare, I think it's even more required from a space of information, access to that kind of information, like what even our Procuro Doctor does on his platform is to provide preventive healthcare information more than even the solution to it. Because we find that in Africa, what is more challenging is the cure for the diseases that they've embodied than even the prevention. The prevention comes from more from the lack of preventive measures come from lack of information and a lot of ignorance towards what could lead them to that space. And above all that we can do physically, biochemically to the body, one of the major aspects of the human nature that helps increase the degenerative causes is mental health awareness, our general well-being in mind, body, and spirit. We tend to focus more on the body, to inject it with medicine, to give it this and that, but we forget that the mind plays a role. That's why we call it disease. The disease, when we have a mental disease, it can also affect us physiologically. If you're not well in the mind, you most likely develop and produce cortisol and all the elements that create degenerative conditions in the body, and deaths. We all spiral down into so many other things that we now need medicine for. So I come from an industry where I believe that with more support and collaboration with the healthcare institutes and systems, we can create more awareness to what it is that can bring more ease to the mind, with the mind, even without even the need for medicine. What role does some holistic practices, what role can it play to the general well-being of people, even those that are suffering for one thing or the other? If you have cancer, for instance, and you are worrying more about the cancer, you might even die quicker. But if you understand, there are some other holistic practices, from dance therapy, movement therapy, from practicing meditation, and so many other areas that, is part of the broad spectrum of our healthcare management understanding, then we can provide more of these solutions to people without them even needing anything physical to consume. Because mentally, they already understand certain practices that they can embody, and it can become a lifestyle. So I feel that more information about all these things that doesn't even require the pharmaceutical company to provide medicine should also be activated when it comes to the general wellness of the populace of our continent or our country. So dance for me is a major tool that I've been using to do that. I have had doctors prescribe dance therapy and movement to a lot of their patients. I had somebody that wanted to do the IVF, and the doctor said, look, you need to be active to improve your body in movement and all of that, because it has a place for that. And I have already embodied the use of technology, just like what Sand was. Our keynote speaker from his company, Sand, the technology in ensuring that certain data can be provided from an artificial intelligence perspective and information provided to the healthcare providers. We also have created a platform where you can log on to and also get some of the quick therapies, movement therapies, dance classes, practices that you can do right from your home or wherever it is that you are. If you can't afford to go to a gym, you can't afford a fitness trainer or instructor, or you don't have any form of machine at all, there's so many things that the human body can do by itself and can achieve, a better health management practices by just knowing it. And we're also trying to adopt it. So I will implore that. Thank God for this kind of platform where we are discussing about human health, because even the economy of Africa cannot grow if the people are dying more, and we're going to be less productive if we are not well. And you can have no cancer, no liver function, damage, no whatever, but you might be mentally a problem to your association or your organization. So are we even thinking about that? Are we really thinking about when the body is damaged? What about when the mind is damaged? So many people are going through recovery from trauma. Look at Rwanda after years and years of war. Look at people like Sierra Leone, Liberia, years of war. These things also affect our general well-being and interactivity as human beings with ourselves, let alone malaria and all the other diseases that we can pinpoint physically. Let's also pay attention to the mental health aspect of it and how to engage various practices that help promote the improvement of these. That will be my take, and I would say I'm open for more collaborations. Whether it's technology or not, please don't look down on our industry. We are scaling beyond just the physical, visual consumption and entertainment and performances that we're talking about. We are really concerned, or at least I can speak for myself and a Proco doctor, concerned about the well-being of the people in our environment. Thank you very much.
Thank you, Dr. Kathy. I know Mr. Abuchi, and in my knowing him over 15 years, I've never heard him speak for more than 2 minutes. So I'm just.
I'll try and make it 3 minutes. Morning, everybody. Afternoon. I hope that this is not one of those conferences that we just do to tick boxes, because of recently I've been doing a lot of creative industry conferences, and I realized, because maybe there's a global theme about creative industry, that everybody just Come and speak, come and speak. For me, this is very particular because I work in a young industry, the music business. We've seen a lot of growth. We've seen a lot of destruction. Because this is an industry where an artist wakes up for looking for money to eat. And in a quarter, he's making 200 million, 300 million, so fast. Most times we've seen that money destroy them mentally, emotionally, physically. Recently, there's been a drug crisis. Recently, I feel like younger people think it's cooler to smoke weed now than other things. And most people would not understand, but the target audience for music is from the start we're getting from Spotify, Apple Music, is between 16 to 21. So most of us, your children, have access to music. And music influence behavior, shape culture. So all these young people, they have access to music via TikTok, has access to all those things right on their devices. So if we just don't communicate the danger, before you know, it's right in your house. Because we've seen now, even with short content, short clips, because of pop culture, they try to push what's cool, what's not cool. And that's what they push. And I've seen like there's a big generation gap between these younger people. Like now, he was giving an example about AI. Every platform sort of have an AI data generation lead platform, even from TikTok, from Facebook, Instagram, you can see your algorithm, and this is what those younger people understand real time. So for us, if we don't innovate on the way we communicate what healthcare is, we don't make healthcare cool for these younger people, I'm sorry, we're losing a lot of people. So I hope that after this conversation, we can create a system around on how to carry the conversation. And first of all, I think you can't give people a task to teach when they don't even know what they're teaching. So we're lucky to have people like you that you're very actively talking about just few misconceptions of what health is. And I've seen like few clips where you talk about don't mix this one, don't mix this. But it's crazy. Like you look at most of those young talent, their tongues are blue these days. And it's a trend, it's huge. And again, who talks to them in the manner they understand? So I feel like this communication, I think one key thing to take from this is communication both ways. Because I work for a young industry, we're seeing a lot of inflow, a lot of growth. And I think one of the reasons we've been successful is because government hasn't gotten involved. We're thriving. And I hope that once we start expanding, and another thing about the industry, I think, is we just don't have the expertise, the people that could communicate and bridge the gap between this new sector and every other sector. So I believe that the more we have this conversation, the more we can trade. We understand the young people, understand the power of culture. We bring back to the table, you give us more information, and we create a win-win situation. And in summary, I was never a fan of healthcare like that. I lost my dad to cancer. Then I understood how Nigeria can happen to you. It was so bad that I had to buy drip stand in the hospital. I had to renovate a hospital ward just so my dad could get decent healthcare. So when that happened to me, then I became proactive. Even from a company's standpoint of view, we're very active about healthcare. But a lot of younger people just don't care because you just feel like it's not their business. Why should I invest? We've talked about sugar, MTV sugar. Just because of that alone, you could see the spike of tests that's happened rapidly. But those are the people that just don't care. That they just don't care about safe sex. They don't care about a lot of things. And if you don't know this is happening every day. All the hotels in the corner are always booked every weekend. I don't know what they are doing there, but it's always booked. And yeah, just look at the stats. Ask around. Just check. The numbers are there. And it's the younger people. Before, I feel like my generation, you see your father's friend, you see somebody, you shy. But these younger people just don't care. They'll say to your face. But it's like, yeah. But like, so I think that we need to now start using this medium and communicate. And I hope that this doesn't end. We can bridge the gap between our sector and every other sector and keep on and learn from people that are doing it, that is working, and create a win-win solution for both parties.
Thank you very much, Mr. Abuchi. And now to my conscience. Dr. Proko, at the end of the day, this is your turf. There's practically nothing you're about to say right now that you most likely have not said on your platform. Just take us through it in 3 minutes.
I feel that's an MC way of calling me a talkative, but it's fine. It's fine, I get it. So I think I'll ask the permission of the audience. Can I speak freely? To be honest, I feel honored sitting in this particular panel, and that's because almost everyone here has been an integral part of my childhood, one way or the other, right? So I have a certain feeling sitting here. Thank you. Thank you. But I would just make a couple of sentences, and I would say this. There's a propaganda I'm not falling for. And this propaganda is channeled by people who view themselves as intelligent. And the propaganda is humans are logical beings. I don't agree. Humans are emotional beings that justify their actions with logic. We can argue this on a later date, but for now I have the microphone. And the reason I say that is because people know better, but do differently. Simply because what drives action is not logic majorly. What drives action is emotion. And emotions are cultivated and enhanced and pushed by stories. When you hear a story, you're made to feel a certain way. You're made to have a certain outlook on life. And whether we like it or not, that influences your action one way or the other. I mean, Kathy had the Guinness World Record at 2006, and I was shocked to hear that because I can still vividly remember how that whole record went. And I'm sure if some of you were, around a particular period, it's almost as if you can still relive the moments. People crowding around their televisions, and some people wouldn't have televisions, had to crowd around their neighbor's television. If you were there, you understand what I mean. But you could still remember it. The same you would struggle to remember what happened in a class as at the same time that happened. How come it looks like the dance seems more powerful in your retentive memory than your classroom that was actually supposed to lead your life forward? Simply because stories are more powerful than data. And another mistake we make is that we think people want to be educated. No, they don't. Nobody walks around, no, let me not say nobody, but because some of us do. People don't generally walk around looking for education. They majorly walk around looking to be engaged. And by engagement, we also have to look at the emotional engagement that the stories are being told. Right? And lastly, but not the least, because, he's looking at me from the side of my eye, I can see him, is that cultures and stories are being sponsored one way or the other. People told me to think freely, or rather speak freely. For instance, when it comes to behavioral actions, drugs, tobacco, for instance, now it's shifting from smoking to vaping. Who's sponsoring it? People are. The companies behind these products are sponsoring those behaviors, one way or the other. From your social media platforms to your movies, to whether you like it or not, is being sponsored. If the healthcare organizations and the healthcare industry does not rise, on the other hand, to create a new narrative, the narrative that is currently on ground will continue to gain ground, and there's nothing you can do about it. Healthcare is cool. Healthcare can be cool. And I'm speaking this way because we've tested this project on so many platforms. One of the most recent tests we did was last year, we came out and said we're going to have the healthiest party Lagos has ever had. And Kefi was there. And the first thing we were told was, it's not possible. They will do drugs, they will drink, it's going to happen in your party, and there's nothing you can do about it. I said, no. I've not spent 10 years building a community of people who are supposed to live healthy and have that destroyed in just one day. Let's test it out. And we said, okay, fine. We'll have the healthiest party. Where? Muri Okunola Park. Somebody said, if you understand that, you're probably in the wrong circle. It was like, that place, how? It's not possible. And my team and I came back together to the drawing board and decided, okay, how do we stop drugs from getting in? How do we get alcohol from getting in? How do we stop junk from getting in? And we tested it out. We had over 4,000 people at Muri Okunola Park, young people. Not a single drug, not a single bottle of alcohol in sight, not a single weed, cigarette smell, nothing. And it was a feat. Unfortunately, or rather fortunately, when we were now celebrating our wins, people said no, people were hiding it in corpse and this. You can see that the narrative had changed. So what I'm saying is that whatever story or narrative bit that is out there at the moment is the narrative you allow to be out there. We can change the narrative. We can make healthcare cool. People just want to connect, whether we like it or not. If we create the right narrative, they will connect, and I would say healthcare gets better when we tell the right stories. Thank you.
Again, I'm not surprised because this is your tough, and these are the issues that you've been dealing with. But ladies and gentlemen, can we give them a round of applause for that wonderful opening? I have questions written here that I intend to ask you, and then I was going to make this interactive. Are you ready for it, sir? All right. The questions here, I know that you can answer them, but I have questions that are personified that I'm sure that, stick to the script. I'll just do that. All right. Nollywood is one of the largest film industries in the world, right? And with its stories, you are able to reach millions of people across the world. Now, how can this influence be effectively harnessed to address critical health challenges such as maternal mortality, mental health, stigma, and diseases prevention? That's number one. Number two, from your experience, what role can partnership play in funding and distributing health-focused content in Nollywood to amplify impact? I have one last question, but I'll leave you with these two for now.
Okay. I had this prepared. Hindsight. Well, first is by embedding health messages in our storylines. For instance, maternal mortality. Nollywood can craft compelling narratives around maternal health, depicting the importance of antenatal care, skilled birth attendants, family planning, and emergency response. When audiences see beloved characters experiencing the consequences of poor maternal care or benefiting from proper health care, it creates a powerful impact. Mental health, stigma, by portraying relatable characters dealing with depression, anxiety, or trauma, and showing them seeking help, recovering, and being supported by their communities. Films can challenge harmful stereotypes. Dr. Apoko was just talking about being in the park and having a drug-free party. All right, so that's one of the things that you can actually use. Recovering and being supported by their communities. Films can challenge harmful stereotypes and normalize mental health conversations. Disease prevention, storylines about HIV, malaria, hypertension, or even pandemics like COVID-19 can educate audiences subtly and emotionally. For example, 93 Days. I don't know if you saw that movie, 93 Days, the movie on Ebola that had Danny Glover and Bimbo Akintola. So with things like that, you can. It's centered on issues. Family affected by diagnosed diabetes or community fighting cholera due to poor sanitation and drive awareness and action. Celebrity advocacy and influence. Nollywood actors are not just entertainers, they're role models. When they advocate for health causes and on and off screen, it can shift public opinion. A Nollywood star speaking openly about mental health or endorsing vaccination can reach people in a way government campaigns can often not do. Partnership with health organizations, collaboration between filmmakers and public health organizations can ensure accuracy and strategic messaging. For instance, co-producing films with NGOs and Ministry of Health. I've said that a while ago in my opening remark. Embedding fact-checked PSAs at the end of the movies and creating serialized dramas, telenovelas, and all that. She talked about sugar, the dish sugar. I know there have been quite a number of health dramas here and there. But what I'm saying is that it's not enough. We just push, and we don't push beyond boundaries. We just stop at a certain point. If you remember, I said I was talking about the Ministry of Health, that if you can have collaborations with them, unfortunately, that somebody might be a clog in the wheel of progress. So many things that Nollywood. Well, a creative industry that's willing to engage. Mind you, before now, nobody ever gave us that chance. Nobody who will ever come to you, come and say, come and talk about who you be. They won't. They'll go to the hospital themselves and queue. Why do you think, for instance, politicians will bring a celebrity to come to his campaign? Because he knows that when a celebrity comes, people will say, oh, they want to vote for you. So that's how it is. So it's not just government alone. We as a people, different communities, we need to begin to spin these narratives around all communities. No, listen, we've passed that era. There is no village in this country today that does not have, that you don't see them with mobile phones. You call somebody today and say, I'm in the village. So if we can get that, why can't we engage in making sure that we have primary health care centers in communities around? Maybe you have like 5-10 villages, find one that's big, and put a primary health care and make sure that it's well equipped. It doesn't just have to be government alone. It could be associations and NGOs and all that. So it's possible. We can do it. The creative industry is ready to help, and we will do it.
Thank you very much, Mr. Shegwari. A round of applause for him, please. I have the third question, but I think you answered it already. Again, just for the heck of it, looking back at the movies that have tackled social issues, what are the key elements that make such stories resonate with the audience and viewers? How can healthcare narrative be woven into mainstream content without losing the audience?
Is that for me, for her?
No, that's your final question.
My final question.
On the script.
Please, can you just go back a little bit, run it again for me?
All right. So basically, how do we fuse in healthcare-based stories without losing the interest of your audience?
Advocacy, right? The main thing is advocacy, actually, if you look at it. And leverage on digital distribution. I had something here with Nollywood. Content driving platforms like YouTube, Netflix, Africa Magic, short films with series and all that. You can actually leverage on that. The basic answer for this is advocacy. There's just no two ways about it. For me, it's advocacy 1, advocacy 2, advocacy 3. The entire thing is advocacy. That's the only way you can do this.
All right. So, will it be okay if I take one question from the audience just for him before I move on to the next one? Is that okay? All right. Is there a question? Please. One. Okay. Can someone get the microphone?
Thank you. Thank you. I'm so honored to be among these legends, just like Aproko said. Thank you so much. I'll make it very brief. My name is Gabriel, and I'm the founder of Gamble Aware NG.
Gambler?
Gamble Aware NG. Gamble Aware NG. We're a non-profit raising awareness and treating people with gambling addiction. And you might ask, what am I doing here? But gambling addiction is a mental health disorder. To give you context, 65 million Nigerians are currently active sports betting, and that number is increasing by at least 500,000 people every single month. Now, what I'm trying to raise here is, and again, it's an industry that is generating in excess of over $50 million daily, not even monthly. That last Champions League match that you watched day before yesterday generated nothing less than at least $70 million in sports bets in Nigeria alone. In Lagos, where we are, I came in from Abuja. In Lagos, where we are, we have over 5,585 gambling addicts that have come to us for help in the last 3 months alone. In just 3 months, out of that number, 769 of them are under 24-hour suicide watch by us, okay? We also, personally, for my business money, we pay 25,000 for 1 hour sessions with mental health psychologists, and most of them will need at least 6 sessions. So do that and do the maths. Anyway, we have a way around that. And if you look around you, most of the adverts are promoting gambling as a cool factor. You talked about some of these social factors being cool. Well, they are making it to look really cool. And our stance is, we are not against gambling and we are not for gambling. But the problem that we are seeing here is that nobody, absolutely nobody, is talking about what gambling addiction is doing. I have over 5,000 unread messages on my Twitter inbox that I've not been able to go through. Nobody's talking about it. And I'll say one thing before I ask the main question. We approached the most popular TV station in Nigeria to help us run a 10-second advert on just gambling addiction. It's a very neutral advert. If you see that advert, it has nothing. And that advert was produced by National Orientation Agency. You know what the guy told me? He said, we're not going to run it because you're going to put sand in someone else's garage. The most popular TV station in Nigeria. So my question to you, esteemed panelists, is very simple. How can we leverage the storytelling expertise of the creative industry to raise awareness on this pandemic? It's a serious pandemic. What does the pandemic have? The symptoms of this pandemic is debt, suicide. It's affecting young age students, young children in the ages of 18 to 24. We have so many campuses. We've only been able to raise awareness in just 3 of them through our campus awareness sessions. We have so much work. It is destroying our young people. It's destroying the future of this country. But nobody is coming to our help. Nobody is telling these stories. I want to ask you, how can we leverage your storytelling expertise to help us raise awareness? Thank you very much.
But for me, it's not a pandemic because it's not worldwide. This is a Nigerian thing, so it's an epidemic in Nigeria where people gamble. This is a very complex issue. Very, very complex issue. 3-4 days ago, or 3 days, Saturday, Champions League, I know the number of people who gamble and they were under 25. And they were saying it openly. It's not just even the Champions League, the Premiership itself. It's a complex situation, and it's something that you really need to sit down and map out a strategy. It's not a strategy that just comes up off the cuff. You just say, hey, this is the solution. So if you find time to relate with some of us in the industry, we will find a way to use it to, get a storyline to pass out the message out there. Iriti?
Okay, well done. Personally, I don't like when somebody gets up and says, nobody is talking about this. It sounds like you're trying to blackmail people into action for a good cause, because there are people talking about it. Gambling is legal, no? Unfortunately. It's legal, it's recognized by the government. So here's what you can do until it becomes really, and that's just the unfortunate nature of human nature, until things get really crazy and wild. you're going to be that lone voice in the wilderness. So here's what you can do. You can follow this gentleman's template. There was a time we all thought Aproko doctor was just that, Aproko, just not minding his business. I have a front row seat to all the days he was harassed, verbally abused, simply for telling people to drink water. It was that aggressive. You have a platform. I'm sure he didn't start out with 8 million followers. Use your platform. You hear these stories firsthand. Make them public. Keep on shouting until people take notice. There's a guy on Twitter who is gradually doing that. He used to be an addict. Thank you. Thank you. And he's making a huge impact. He's opening people's bum, and he's doing it effortlessly. So take advantage, use what you have for now, and trust me, there'll be an avalanche as time goes on.
All right. Ma'am, I think you should just hand her back the microphone, because... all right. You have built a legacy of storytelling that brings real-life issues to the forefront. Now, how do you think that the film and television can simplify complex health challenges, making them more relatable and easier to understand for everyday Nigerian?
All right, I believe that film and TV have the unique power to simplify complex medical issues and put a human face on it. For example, it doesn't matter how rare or how strange the medical condition is, if you skillfully embed that condition into a compelling storyline, you make that part of the daily existence of a fictional character and get your audience to invest in that character's journey. That's it. You've demystified that thing. People are now invested. There is information as to the cause and effect, the cure. You actually see, the audience gets to see how this hitherto vague medical condition affects a human being. You get them invested. You see that emotional investment? That is what makes the story stick. That is what ensures that people don't forget. And, it now becomes their story. You're shedding light. You're getting rid of stigma, and you're creating awareness and giving people the opportunity to go, is this what I'm experiencing, or is this what is likely to happen? So you're creating an awareness, and that's what TV and film and all these other creative expressions do. It brings people into the middle of that situation, so you get to experience it firsthand. And like you said, people don't... I need you to, get me to feel something. If I can get you to feel something, that means I can get you to invest in it. There's more to my answer. This thing keeps shorting.
All right. So the second question from my script is, women and children often face the brunt of healthcare challenges in Nigeria. In what ways can the creative industry contribute to shifting cultural perception and driving more inclusive health policies?
I'm going to go back to storytelling, and that's why we're here. We're creatives. Don't just throw out data. 10,000 women are dying here. 5,000 girls are dying there. Tell the story. Show people what is happening. Create the situations. Walk me through the process so I feel that pain. That is what galvanizes people into action. Hold on, this thing keeps shutting down. Behave. Yeah? Creative projects can also be used to challenge harmful cultural norms. Okay? Films and plays that depict positive images of women making informed decisions, healthcare decisions, or accessing services with ease can help change perceptions about gender roles within the families and communities at large. And these examples abound. He mentioned 93 days. That shed more light on, what healthcare workers go through, the role that women play within the health system. It also helped to spark conversation on the need to advocate for their safety and how. All right? Another example is the Al-Majri series, which highlights the predicament of northern children, children in northern Nigeria, I do beg your pardon. So this is much more than a story. And if it is skillfully done, you also have the numbers, you have the data, you have the cause, you have the effect, so that a listening government who is determined to do something about this has ready data. You can use it to extract data, which will help you formulate policy. Okay, another example worthy of mentioning, because I remember the huge noise that it created globally, was a 2014 production titled Dry. Who remembers that? Dry, produced by Stephanie Okereke-Linus, which shed light on the plight of Nigerian girls who are being married off at an early age, and all the medical challenges that, affect them as a result of this. So that is the power. That's what storytelling, that's what creative communication does for the health sector. It gives, these things are no longer random. They're not just big words on a paper or numbers and data that you don't understand. They become real life human beings, human stories that you can relate to. Yeah?
Thank you very much. You've actually answered my third question, but I'll just read it out so that if you have anything to add to it.
Yeah.
Nollywood has immense cultural influence. How can it be leveraged to change health-seeking behaviors, such as increased vaccination rates or regular medical checkup? Are there examples where you have seen this work effectively?
When I read the question, I smiled at increased vaccination. I'm going to pick your brain about vaccination. There's a global debate going on about vaccines and the effect and what it does and what it doesn't do. But hey, back to Nollywood. Nollywood reaches millions of people every single day, not just through entertainment, but through stories that reflect real life. And because of our reach and the emotional connection that our art invokes, it has the power to shape how people think about health, what they fear, what they trust, and what they believe is possible. When we weave health themes into compelling storylines, Nollywood can help normalize positive behavior like regular medical checkups, mental and sexual health conversations, without sounding too preachy and too technical, which is what the average Nigerian tends to run away from. One of the reasons why Dr. Drink Water. One of the things that makes his content so compelling is that it is embedded in humor. You will laugh as you're watching it. But when the laughter dies down and you remember one or two things that he has said, it will stick. And if you're smart, you will take action. All right, so when we weave health themes into compelling storylines, Nollywood can normalize positive behavior like regular medical checks, mental and sexual health conversations without sounding too preachy or too technical. When people see these characters experiencing these situations and doing all these things, it breaks stigma and creates trust in the system. Yeah? So that's...
Thank you very much. Can we put our hands together for her? All right. Now, should I take one more from her, just like I did the men? Okay, I'll just move on to Dr. Kafi, and I'll get back to her if we find the time, and I'm sure we would. Dr. Kafi, you've led a wellness program that combined dance and with fitness. what are the opportunities for scaling such initiative to public health campaigns in rural and urban communities?
Okay, thank you very much for that. So I usually, one of the things that I did or used to do was go on tour, physically go on tour to different environments, both in Nigeria and outside Nigeria, to first of all raise awareness about how movement can, enhance well-being, both mentally and physically, right? And we've done that through touring. And I've also established my own fitness wellness studios to actually engage more community-based interaction and interactivity. And post-COVID, so during COVID kind of limited that because, except touching each other, being in close proximity was a thing that was not advisable during that period. And that was what led me to go into the technology side of things, the use of technology. And I found out that I scaled pretty faster and I had more access to more people. And I think COVID already kind of found a way to help us change the perception about virtual classes because people were stuck to needing virtual classes. So the average Nigerian mentality towards virtual classes was very, almost feeling like they are not getting value for their money if they are not seeing the instructor or being in the same room. But COVID changed that narrative for us. And what I was afraid of initially was, will I be able to get the same results from my clients virtually versus how I had the results when I'm seeing them one-on-one. And I found out that I kind of derived and integrated some of the curriculum of, what I put together in my programs and created it in such a way, like you said, emotionally and also engaging in nuggets that people can consume without it being too stretchy, but engages them to want to commit to it on a daily basis. So I found out that the use of technology also worked because we had a 97% success rate for people who were on whether it's the weight loss journey they wanted to go for, or so women who came in just for the mental health improvement, because COVID people were in the house for a long time. There was a lot of major outbreak of mental health issues during COVID scenario. So I've been able to use technology more recently than actually going in person, and I found out that scaled much more because, like I said, the perception of people and adaptation to virtual classes has improved, and I feel that is one aspect that can allow us to reach millions of people per time. So I cannot be in 5 places at a time, but I can be via the use of technology because, like you said, Mama, even the villages now, people have phones. They can access some form of technology, no matter how simple. So we simplify this to consumable programs that it can do that. And that is one of the areas that I feel we can do. And even from a national or scaling it on a bigger level, like we said, advocacy is very important. And for these sectors that are really concerned about the well-being of people to actually merge with us much more. Right now, a lot of us are using our own personal phones or relationships with certain sectors, either private sectors, to drive some of this narrative to sustain it. So driving the narrative is one thing, sustaining it so that one can keep doing it. I've been a fitness and wellness coach since 1997, and I've been pushing the narrative of improving healthcare through dance and movement therapy and so many more, especially when mental health area, through the course of driving this and going one place to the other without any support whatsoever until social media became a thing. Now we can be in one space and reach millions of people at a time. I've had to partner with Dr. Mimuna. I've had to partner with so many people, even at Proco Doctor now. We recently started talking more to just increase our network and our strength in the voice that we require to drive the narrative of social conditioning towards better wellness practices. So I feel that we just need to continue to do what we're doing. The use of technology is important. The need for agencies to collaborate with us more to drive the sustainability of whatever we've created is another thing. Look at the MTV Sugar. I don't know how many more shows we have like that is engaging as that because that just died out. What can sustain more of those kind of what is it, sir? Is it there? Yeah, so we need more sustainable help because creating it is not the problem. We are creating every day. There are many people. There's another one, I've forgotten the pediatrician that does for kids is online as well. Yes. So we have so many people, but sustaining it. we're sustaining it mostly on our own right now, off the back of our own, and the influence and whatever small money we make out of influencing, we are taking. And before we can even get somebody to put money down for a project that Procode needs to do or I need to do, everybody wants to write on your numbers, but how many people want to write on the cause? Do you understand what I'm saying? So that is one of the major problems that we're having. So do we really care, or do we just want to just siphon whatever it is that we have all established so that your product, services, and market is more visible? But I believe that if we really do care about people, trust me, in less than a year, Nigeria can overturn certain narratives so quickly if we're not really concerned more about selling products and services than the people that we're actually asking to consume the products and services. Because if people die, who will buy your product? Do you understand what I'm saying? So I feel that is one thing to talk about the avenue. I think sustaining the avenues when we recognize them is something that we should also look at. Thank you.
Thank you very much, Dr. Kafi. As a matter of fact, I had 3 questions for you, but
Okay.
you've actually answered all of them in one.
Thank you.
In one. Put your hands together for Dr.
Thank
Kafi. And to Mr. Abuchi, I was almost going to call him doctor because everybody is doctor. All right. To Mr. Abuchi, music has long been. I think I'll just take all your questions because you seem to have a way of answering all of them at once. All right. Music has long been powerful tool for mobilizing people and spreading important messages. How can the Nigerian music industry be leveraged to promote health awareness and inspire collective action for better public health outcome? That's number 1. Chocolate City Music is known for influencing culture through music. What would it take to create a cross-industry collaboration? Sorry, one moment. All right. What would it take to have a cross-industry collaboration where top artists champion health causes similar to the global movement, like We Are the World, I Was Here? Yeah, we'll take that too.
So, I think number 1, we need to talk about education. Because most people in this industry, the people in the forefront are young. They're like these young test makers. Like, you need to understand what you preach. You need to know. So I feel like we need to build that knowledge gap. So people need to understand what they're preaching about. I'm sure the reason why Dr. Aproko doctor is doing well is because he's a doctor. Have good knowledge of what he's talking about. So you can, of recent now, you can see a lot of artists, their voice has cracked. We don't know why it's cracking. But we need education, we need knowledge so they know what they're preaching. So I think number 1, knowledge first. And then I believe that music is a vehicle which can heal the world. I think Bob Marley always say when music hits you feel no pain. Like, music is that powerful. So it's when I feel like once those guys are educated, they understand certain key value, key things, then automatically you translate through the music. Because if you see the music, they always talk about pains, pleasure. It's about certain things they experience in life. So once they're educated enough, I think it will trickle down. And again, I feel like there are a lot of low-hanging fruit. Where most of these cases, cancer, a few people, most of them have experienced it firsthand from their mother, auntie, uncle, somewhere. So I feel like there's that low-hanging fruit. It's like, how do we now let them relate? It's like, how do you do an episode with someone that has lost his mom to cancer and talk about what are the steps he should do? Because music has now transcended just not music alone. It's about content. It's about top of mind. It's about how do you now break down. We talked about a lot about storytelling. But as much as storytelling is important, it's like, how do you break it down to serve to people? Because this is the younger generation. If you don't give them in bite sizes, you're wasting your time. So it's like, how do you cut? That's why TikTok is really winning now. Like, how do we cut down these episodes in such a way that you don't lose them, they're engaged, and they understand what you're saying. The second question is, how do we partnership? I feel like avenues like this is first, because now we're talking, and in so talking is we create value for both people. And I just don't think that even the music business have a lot of value to bring. We did a concert recently where there was a stampede and a lot of people died. And then I'm just researching that there's a whole ecosystem in where you need to have an ambulance, you need to have like this whole health system, you need to have water for how many people, you have to create an exit. But for every successful concert, that means there have to be a medical plan around it. But most people don't know. So I feel like it's even a value for this other ecosystem. Even movie set. So I think that even just this is a first. And I think conferences like this are important. So we need to now start building the bridge between both people. So I don't think we're always here to take, we're always here to add value to. So let's have the conversation start going.
Right. I'm going to ask you the last question because it's about sustainability and funding, right? Yeah. So the question is, in terms of sustainability, how do you think music-driven health campaign can be funded? That's number one. Funded and scaled. And are there existing models we can learn from?
Oh, yeah. They've been, so I'll talk a bit about publishing and intellectual property. It's quite unfortunate that our banking sectors don't understand. If you want money, they say bring your house. Where you have intellectual property that you can earn for this lifetime, and the laws that protect you. So you can have artists that they're very sympathetic to a cause. They'll give you 2 points from their publishing and say, hey, fund this cause from it, which I think Bob Marley gave one of his best friends how many % of his publishing that earned millions at the end of the day for a cause. So what they do globally is I'll do a song and I'll give my publishing or my master right for this cause. And every revenue that is being generated goes towards this cause. I think that those models exist. We could just copy and paste and it could work. But again, we need people that understand the model. We need people that understand that and generate the revenue. And from out, again, I'll talk about this industry I work for. A lot of them are shy. They run away when there's anything that has to do with government. Like now you talk about public health. Once we see somebody government there, we run away. Because we believe there's money somewhere, somebody has had the money. And again, in fairness, it's from experiences where they just need the artist to come and be here, so just to loud the communication and slap your face on the poster and then keep it going. So I think, again, we need to bridge this trust gap between both people, which is like, and again, to you guys at the other side, you have to communicate, not just communicating in a way that the people in the creative sector understand what you're saying. So if you're saying this is a white couch, you need to understand this is what white means to me and this is what white is. Not just throwing the numbers, throwing the cause and effect, but it's like communicative effectively both ways. And I feel like if that communication is done properly, people will jump. I've seen artists give points for things that doesn't make sense. If you know how much they spend per night at clubs, one table is like 5 million, 20 million, and they spend going. These are costs that I know a lot of them would really give, and we can sustain it. But again, is the trust. Is if I give this money, will you do what you said you would do? And again, how do you tell your success stories? For example, the lady showed the presentation about all the great works they've been doing, but normal, they will read. It's just waste of time. You're just bouncing it. It's like, how do I do short clips? How do I tell the story effectively? 5-minute clips. This is what we've done in this short time. This is the impact. Let's get real people that have experienced that. Come and tell your story, your testimonial. Then you get more buy-in because that's how you understand communication. So, yeah.
All right. So that is. Oh well. So that explains jingles. In 1 minute, you drop a jingle that attracts thousands of people. That's basically what this is. Can we please give him a round of applause? Thank you so much. Thank you for simply putting it. Thank you. All right. You have mastered the art of simplifying medical knowledge to everyday Nigerian through digital platforms. What inspired you to take that approach, and how has the impact been so far? Hold on. Your content reaches millions online. In your view, what are the key elements of effective health communication in the digital space, especially for misinformation control? Now, I say this because there was somebody who was very big on medical information and advices and was referred to as a legend. Recently, we found out that the person was under the influence of drugs. So basically, all the person's advice has been coming from drugs, not from medical experience. No, true story, and if I say the name, I'm just going to withhold the name just so that our attention is not diverted. Over to you, sir, and then I'll ask you the last question.
Okay, so the first question is, what basically inspired this? I'd say learning, right? And learning in the sense of, I initially didn't even start out to be a Aproko doctor generally. It was because I had come across a lot of patients, especially during my foundational years in medicine, and I realized that people just kept coming back to the hospital, and sometimes they came back in worse conditions. And when I started to ask questions, I realized that a lot of people did not really understand what healthcare is generally. So people could be literates, but they are health illiterates, right? And so, because someone leaves the hospital and they say, the doctor said I have hypertension. What exactly is hypertension? No idea. They said my blood pressure is high. Could you explain what exactly that is? They don't know. And because I was privileged enough to start my practice, especially in the very rural areas, in some very rural areas, I wanted to help. And so the initial first part was start with outreaches, and then we started outreaches, reach a couple of people per region, just, here and there, small outreaches. But something in me just wanted to do more. I wanted to reach a lot more people. And I had the crazy idea of starting out in radio. And I went to a radio station that was very close to where I was studying at that point. It was in Oba. That's in Onitsha, very, very close to Onitsha, in between Onitsha and Newi. And the radio station listened to me for 5 minutes, and they told me, we'll call you back later. Of course, you know what that means in Nigerian speak. But, I had listened to Kuli, the motivational, and I said, do not take no for an answer. And I went to the next radio station, and they listened to me, and they said, you know what, we'll get back to you. Looking back at it, I can sort of put two and two together as to why I was not being called back. It was because I went to a radio station filled with passion, but I just wanted to educate. And so whenever I sat behind the booth, just educating people, I was scribing to them. Nobody wants to be driving at 4 p.m. in Lagos traffic and be listening to prescription, especially when, it's stressful. People want to listen to stories. But I did not learn that lesson until almost 5 to 6 years later, where I think I was frustrated at the whole thing because I had employed every skill available in my arsenal. At some point, I was a digital, designer, design artist. I drew designs. I posted it. Nobody was paying attention. So, I kept moving from skill to skill until something happened at the hospital where I was working, and I decided to tell a story about it. Of course, protecting the identity of my clients. Yeah, I don't want to call them patients. Let's call them clients. And that story went viral, and it went viral in a way that I never thought was possible. And that was when the light bulb went off in my head. I'd been doing all this, but it felt like no one was paying attention until I told the story. So it felt like the storytelling was the missing link. And so what I did was simple. I went back to everything I had been saying and decided to tell stories about it. And it just kept climbing and climbing and climbing. And, just like Madam Iriti mentioned, it got me a lot of flack. One of the first people that it got me flack from was our community themselves. And that's because medical doctors are not supposed to speak like this. So why are medical doctors speaking in a way that, doesn't seem dignified, so to speak? Yes, it was unconventional, it was unorthodox. As a matter of fact, if our Proco doctor had started like this, we'll probably not be sitting here today. And that's because one of the things I think that would also segue to the next question is, what are the things that have helped me so far? I think one of the first things is relatability. For you to say a story, the people you're telling the story to have to see themselves in those stories. That's why we shout Emeka and Nkechi come forward. Simply because Emeka and Nkechi are basically characters in the story. And the people who are listening to the story can see themselves in Emeka and Nkechi, right? Another thing that has also helped is consistency. Look, you are not going to change a culture by a viral post. It never happens, almost never happens. You're going to have to always feed back on the last story you just told, and that requires consistency. That requires, persistence. You just have to keep going at it, because the other side of the divide, because I like to view it as the other side, they're not relenting. No, I promise you, they're not. So you can't say because I made one story and we invested so much in this story, and it got us a few million views, we've effectively changed culture and changed behaviors and improved healthcare. No, you're not going to do that, because you're dealing with deep-seated behavioral instincts in people. When we're looking at health insurance, for crying out loud, the common narrative is health insurance does not work in Nigeria. I don't believe so. I believe that we have just not told the right stories about health insurance. Another thing that is also very important about healthcare and storytelling is trust. But trust comes with time, right? But if you are not in the healthcare space, you have told you're probably in a healthcare organization that have seen thousands and hundreds of thousands of patients. You've built trust over time. You can translate that into real life experiences, because trust is a very important part. Whether we like it or not, word of mouth still is the biggest form of advertising, so to speak, but it comes from the stories that we tell ourselves. People, trust me, premiers don't convince people to watch movies. I've seen that movie. I think it's good. I think you should see it too. We trust the opinions of people around us rather than the opinions of something on a billboard. So if I see something on a billboard, I'm looking at somebody around me. I said, have you tried this product before? He said, yes, I think it's something you should try also. Usually, there are products that you haven't even tried simply because somebody around you said it's a completely worthless product. So it shows you just how powerful storytelling is. It could make your bias, it could break your bias. And that's why I am currently an advocate for storytelling in healthcare. I will continue to do it. I will continue to say we need to tell the right stories. We need to be consistent about it. We need to build credibility. We need to build trust. Mentioned something about vaccines and vaccine hesitancy, and COVID was a very important. We had educated people who had bachelor and master's degree, putting salt water in buckets and taking their bath with it. Yes. It seems like something out of a movie scene, but it's not. Educated people, real life. Why? Emotions. People were afraid. So I'm saying this, that if we should learn to persuade people for good. And sometimes in persuasion, you may need to employ certain tactics that to you, especially as healthcare organizations, this is something that, we've said cannot be. Fear is a very powerful emotion. Fear can be employed. Sadness is a very powerful emotion. That can be employed. Anger is a very powerful emotion. That can be employed in your storytelling. Not all the stories that you have to tell have to be kumbaya, kumbaya, is such a beautiful world, everybody hakuna matata. No. Tell real stories. But for you to do that, you're going to have to employ and get the services of experienced storytellers. I'll give you an instance. Last year, we screened a couple thousand women for cervical cancer. And before then, we had been saying, screen for cervical cancer. If you're sexually active, get yourself screened. And yes, it worked to some extent. But something changed. Something flipped when we decided. So I went back to my team and I said, let's just create a short film. It was a 5-minute film. And the 5-minute film was basically what we almost expect from every, film. a philandering husband, I'm very sorry for the men, a faithful wife, and an angry son. And this woman, she'd been faithful all her life, but then she ended up with cervical cancer. And after the movie, there was a call out for, and it happened on YouTube movies. So it wasn't something that we had to, create so much. My brain is going somewhere else, but I'll drag it back. It wasn't something that we had to create so much fanfare about. We just put it in the same platforms that these people, frequent every once in a while. Also, another thing is, if we're saying that we're going to tell healthcare stories, I think we should put it in platforms that the people we are trying to reach are, to be honest. Yes, I know getting a streaming deal is good for your pocket and good for the clout, but if it doesn't really get to the people you're supposed to get to, have you really made impact? Because making the story is one thing. Making it available to everybody is another thing, totally. And whether we like it or not, it's not cheap. It has to be funded one way or the other, right? So immediately after that story, it was on YouTube, and a lot of people watched it. There was so much traffic at Maryland, which was where we had the screening, that people were wondering if there was a crusade that was happening. No, it was simply women who turned up. They had watched the movie, they had seen themselves in it, and now they wanted to be free from it. What did we use? We used anger and fear. But it wasn't Aproko this time saying it. It was just a story. So if we employ this over and over and over and over again, we can really change the narrative about healthcare in this part of the world. And I strongly believe it. Thank you.
Wow. The thing about media is perception. There's a camera and then there's somebody in front of the camera, right? And this is the part that they would like you to see. Now, this is not the part of these people, these resource persons that we have seen. I mean, this is not what we're used to them doing. Ladies and gentlemen, I think they deserve, if possible, a standing ovation. Can we give them that? It will take just 1 minute. Can we put our hands together for them? Make it louder. You can do better than that. Thank you. Thank you.